Good afternoon, friends. Welcome to the live chat on spine problem and spine health from Columbia Asia Hospital, Palam, Vihar, Gurugram. Today we will take up a session on addressing the issues of spine, which is becoming very common these days with more and more people taking up to desk jobs or a lot of use of the mobile phones. And that is bringing up a lot of younger people to our hospital and OPDs who keep on complaining about pains in the neck region, pains in the shoulder region, scapular area, sometimes pain going down the arms, sometimes they have a sore shoulder and sore neck, and similarly a lot of them come with a lower back discomfort, pain in the lower back, sometimes pain going down to the buttock region, and a few of them have a pain that goes all the way down the thigh and the leg, which as doctors we call it as sciatica pain. The reason for these youngsters who complain of such symptoms so often these days is the overuse, I'll say, of technological gadgets like laptops, desktop computers, and smartphones. Most of you who are joining here are also using the same gadgets to connect to us. And these very gadgets, though they are very helpful in our day-to-day life, very productive, they save a lot of time for us to travel. And we can connect with family and friends, we can do internet banking, do not need to go to the banks, and we can do online transactions. But the amount of usage of these gadgets is also predisposing our spine, especially the neck and the lower back, to unusually high incidence of spinal problems, especially in the younger population. What we used to see about 20 years ago in 60 years patients, 70 years, nowadays we have started seeing those conditions appear in patients who are maybe in their 30s, sometimes who are there in their early 40s, so which is unusual. And nowadays what we are realizing is that these people are developing these problems because of the overuse of technological gadgets. The other problem is that as we are using these gadgets more and more, our outdoor time, our physical activity time is getting cut down. So the amount of running that we do, amount of walking that we do, or sports activities, a lot of people are not pursuing any active sports, and they end up injuring their spinal muscles and the spinal column, not by one single force, but by a repetitive force, because as we keep on sitting, our muscles become sore, our muscles become fatigued. And when we turn with the fatigue muscles, twist and turn, at that time they have a higher chance of getting injured and torn, which we call it as sprain. So this collectively is called as RSI. RSI means repetitive stress injury. So we have to understand that it is not many people think that I have never lifted any weight, I have not fallen, and still I have developed pain in the back. Why is it so? A lot of patients ask this question to us in the outpatient, and the answer that we have to we tell them is that it is not one single factor that is causing you trouble, but a cumulative effect of repetitive wear and tear of day-to-day daily activities that piles up and ultimately leads to some kind of an injury that, if is not taken care of well in time, can become the seed for a major spinal problem in future. So we need to watch our lifestyle. We need to sit back and realize that what we need to achieve by doing long sitting hours, even at work, or watching movies or watching phone or computer at leisure. What we recommend these days is that even if you have to do sitting work for longer time, a lot of your work, like software professionals, they are working from home or in office. Their job is mainly to sit in front of the computers. So we recommend that after every 30-40 minutes, if possible, you should get up from your chair and take a break of couple of minutes itself. It's not mandatory that you have to take 10-15 minutes coffee break. Just a couple of minutes of break, getting up from your chair, doing a little bit of stretching activity, and some general physical strengthening, like twisting your neck like right and left, lifting your shoulders like up, rotating your shoulders backward or rotating them forward, and then arching your back by standing. These kind of things can offset the spasm in the muscles that happens, and that can allow some nutrition to flow to the back, which may not happen that well when you are sitting for long durations. So these very small steps can protect your back and neck from developing this RSI, the repetitive stress injury. Secondly, you have to see that what are the methods that you follow to pick up things in your day-to-day life. Like whenever there is something that you have to pick up, what is your reflex action? Do you bend right from your back and pick up the things, or is it that you bend from the knees? So as doctors who give you ergonomic advice, we will always recommend that instead of bending at your back, you could partly bend at the knee, partly bend at the hip, and then a little bit at the back, so that you are able to pick up things from the ground when you have to do that. Especially when you bend forward, you should avoid picking up of heavy weights more than 5-6 kg, because in bent position, a 5 kg weight would exert a 3 to 4 times force on your lower back than if you were picking up the same weight in an erect standing position. So that particular cumulative effect of heavy weight would cause damage to the ligaments and other soft structures in the back, and which will become the source of chronic back problem in future. If you have to pick up things from the lower shelves of the refrigerator at your house, we recommend that you should bend at the knees and the hips rather than at the back, kind of sitting position. Take out the shelf, take the things out, put them in some smaller basket or a dish, and then push the shelf back, and then you stand up. Most of the people, they do is that they'll bend from their back, take out the things, and then can get up with the weight in their hands. So that is one short recipe to cause damage to your back if you continue doing this thing over years and years. Similarly, if suppose you have to pick up a weight and take it from one place to another, we recommend that try to keep the weight close to your body. So you do not hold the object, heavy object, away from your body like this. Try to keep it close to your body. So that will reduce the amount of stress your back will have because of the force factor. So these are small things. If you adapt in your day-to-day life, you can reduce the chances of injury to your back and protect yourself from developing serious problems like slip disc, sciatica, which otherwise are not that bad these days in the modern world. They can be very safely treated, but a few cases of slip disc and sciatica can develop serious life-threatening problems like paralysis or loss of urine control, etc., which could be a life-altering events. So one should try to protect one's back as much as possible by following these small lifestyle changes. In addition to that, we would always recommend that you should do some kind of physical activity, preferably that requires you to do walking or a light jogging or a light running, which will allow by compressive effects, compression and release, it will allow the nutrition to flow better in the spinal disc and thus protect it from degenerative wear and tear. So 20 to 30 minutes of a moderate paced walk is a very good activity that you can use for protecting your back from major spinal injuries. Similarly, if you can find a good physical therapist close to your place and seek an advice regarding gentle back strengthening and stretching exercises, and if you do that for 5 or 7 minutes in a day, early morning or maybe at night also, because you can do them very comfortably with or without having taken any meals, it does not matter much. So that will also strengthen the muscular forces in the back as well as improve the range of motion of the back. So these things will ultimately add up to more flexibility in the spine and stronger muscles, which will be able to tide over the stresses of wear and tear of your back, which happens in your day-to-day life due to your work and other living conditions. So these are the major things that one can do to adapt good spine protection lifestyle to avoid getting injured in the back and to avoid serious problems of cervical spondylosis or slip disc or sciatica or even paralysis in, if this is left unattended and unchecked for, though the chances of that is happening is very small.
And